Has a patient ever gone missing? Or what's the weirdest place you ever found a missing patient? Missing patients, busted teeth, and cracking open chests. What is going on in the emergency department? Today, we are breaking down your wildest, weirdest, and most painfully honest questions about what really happens behind those hospital curtains. Let's dive in, shall we? Have you ever had a patient come to the emergency department naked?
Naked? Yeah.
Typically, people who are without clothes usually come via ambulance or in custody. So meaning like some people are running around the streets without their clothes on. They might have a psychotic breakdown. They might be in a psychosis. But majority of the time, we don't see somebody walk through the emergency department, check in, and just, casually walk into the hospital. Really, really sick individuals from home might not have their clothes on. But it does happen, but usually in a very rare occasion. Has an emergency ever happened outside of your hospital, like at the steps of your hospital or inside of your hospital? Yes, all the time, actually. Code blues happen, on the floors of the hospital, in the rehab centers. So that way there's a specific team that always responds to it. And so this usually happens, just outside the doors or in the lobbies. Sometimes you have to call 911, literally, versus can you go out there and get the patient? But yes, we run out of the emergency department at times to go help individuals. We have patients that have been dropped off in front of the emergency department's ambulance doors, as well as the front entrance doors. And so for those individuals, yes, there will be a code called. Somebody will go out there and help, maybe put them on a gurney and get them right in. Have you ever had to do an extreme procedure like burr hole in the skull or crack someone's chest open? Yes to the latter. So a burr hole would be used if somebody has high intracranial pressure, typically due to a bleed in the brain. And what you're doing is you're putting a hole through the skull to access the lateral ventricle to decompress that area, typically on the opposite side of the bleed. I haven't had to do that, but I've been witness to it happening in the emergency department that the neurosurgeon actually does it. So a cracked chest is a thoracotomy. Thoracotomies are done when typically the indication is if somebody has pulses and then they lose pulses in the setting of penetrating trauma to the chest. Make an incision basically on your left flank, going all the way to your sternum and around rib space 5. And then you put your rib spreaders between those ribs, crack that chest open, and then move the lung out of the way and access the heart. You cut the pericardial sac without hitting nerve, and then you access the heart and see if there's any defect that you can fix. Now you got to get the heart restarted. So you can massage the heart, you can do CPR on the heart, and even use internal paddles. Do you ever sleep on your shifts? Why is that even a thing?
You need to lie down somewhere.
At the hospitals I work at, currently, it is way too busy for anybody to sleep. Sometimes if you're in a rural hospital or a smaller area, there could be lulls of time where patients don't come in, say overnight. So you might have discharged all your patients and it's 2 a.m. in the morning and there are no patients there. Sometimes you can fall asleep in your chair. Sometimes you can go lay down on the couch, and the staff members are always there to get you if a patient comes in. But majority of the emergency departments nowadays, they're staffed to a point where people utilize the emergency department 24/7. So the likelihood of taking a nap is pretty low. Say you're a surgeon and you have to be on call in the hospital. They have surgical rooms that you can take a nap between cases. Has anyone ever pretended to not have ID so they didn't have to pay or use insurance? I don't know the reason why they wouldn't have ID, but yes, a lot of times people will show up to the hospital without identification. But I don't deal with insurance, payment, anything like that. My job is to see you and treat you. And, by law, we determine if there is a medical emergency that we have to treat, and everybody gets a medical screening exam. So, that's not in my realm or my universe of thinking when I take care of a patient in the emergency department. Have you ever worked abroad? Have you worked as an emergency medicine doctor in any other countries? When I was a fourth-year resident, I did go to St. Croix, which is a U.S. Virgin Island, and I worked at that hospital. Really cool experience, really nice people, good training for myself, and so yeah, saw some really interesting things and things that you wouldn't necessarily take care of stateside, so to speak, on the mainland versus island medicine and tropical medicine. So really interesting, really good experience. Thank you very much for all the staff members at St. Croix Hospital. My last ER visit was hell. I had to wait 3 hours with a broken femur to get a room, then 12 hours to get my surgery. Did I say the wrong thing? Is there a secret way to get seen faster? Should I have said I had chest pain? It all depends on the ER system, the availability of a bed. They may not even have had a bed to be able to put you in, and there are laws. So say here in California, we can't have patients in hallway beds. It's against the law. So you can't just make more beds. Nowadays, we try to get doctors to evaluate patients immediately. So meaning, the hospitals I work at, there's a doctor at the window. So you're getting assessed immediately for life-threatening problems. Say you're identified having a femur fracture, but if everything's stable, then it's just trying to get you OR time. So meaning maybe the operating rooms are all filled with cases, but I'm sorry for the individual that had to deal with that. Okay, honestly, even thinking about the ER can spike your stress. Whether it's waiting 6 hours in a chair with a broken bone or spiraling because you WebMD'd your headache into a brain tumor. That's exactly why I made Chillax, a doctor-formulated fast-acting supplement with magnesium, L-theanine, saffron, and skullcap to help take the edge off. It's not for emergencies, but it's for when your brain thinks everything is one. You can grab Chillax at lifehappens.com or on Amazon. Have you ever had to make a tourniquet out of something in the ER to save someone's life?
I have? Look! Just a flesh wound.
Actually, yeah. So I've had to take strips of sheets and cut quickly to make a tourniquet and then basically use like any device I could find in the ER. I ended up using a finger splint apparatus. This way I can slow down the bleeding of somebody's arm so we can assess the injury and make sure they didn't bleed out. How do you handle drug seekers versus actual patients? Do you ever have frequent flyers? Frequent flyers first is basically somebody who comes to the emergency department often. So we see everybody. We don't turn anybody away. When addressing pain, it's kind of up to the individual doctor how they handle it. So sometimes you just have that conversation with the individual and say, okay, what is going on? How can we help you? Different resources, and you address the situation. And sometimes you use, the resources of social workers in the emergency department, different types of staff members that can be helpful for that individual, because we know the effects of chronic long-term use of these type of pain medications, and we don't want somebody to get stuck on it. What do you do if you have no ride home from the hospital? Do I get a taxi coupon?
Man, forget it. Yo, home's the Bel Air.
Well, we want you to figure out a way to get home. So, it's something that is not given out that often. Hospitals that I've worked at, they have to be approved by case management and social work. So, it is not common, but again, you're not going to be abandoned either. If a doctor is off duty and has an accident involving a person, can he practice his profession in a hospital other than his own? So typically, no. You don't have what's called privileges. You haven't been vetted by that hospital. You don't necessarily have privileges at that hospital, and you could be held liable if you intervene. Yes, if we're in that type of situation, we still will try to help, but again, we can't help in another person's hospital that you're not credentialed at. Have you ever run out of blood or something super necessary in the ED?
Blood, and
So sometimes, natural disasters can get in the way. So a couple of natural disasters like hurricanes recently had kind of affected the supply chain relating to like IV fluids. And so IV fluids were just not given out as frequently. So people who could drink fluids would, be given water with maybe a little bit of salt in it versus getting an IV version of it. Or if you're getting close to running out of blood, the hospital will let you know. And then you have to basically give a reason why you need like the last little bit of it. But usually they have supplies enough in that situation. That Lucas machine, the one that does the CPR for individuals, it's battery operated. So if you have a prolonged code, sometimes the batteries can die and you run out of batteries. So you have to go back to using, normal human power. But, the majority of the times I've never seen a negative outcome due to not having the supplies. Has a patient ever gone missing, or what's the weirdest place you ever found a missing patient? So patients sometimes will leave or go missing. You're like, wait, where'd the patient go? We didn't discharge the patient. Patient has an IV, we need to find them. So if you leave the hospital with an IV in your arm, we'll try to get you back, but if we can't find you, the police will be notified and they'll try to track you. Have you ever found patients in weird places? So sometimes you find them in like chapel in the hospital maybe. There have been cases where I've seen patients crawl through the drop ceiling in a hospital and end up in other patients' rooms or different areas of the hospital. If you work in a hospital, have you ever had a patient disappear on you? If I have a dental emergency like teeth getting busted out, do I go to the ER or a dentist? So as ER doctors, we are trained from head to toe. So we will be able to assess the situation, stabilize it to get you to the dentist, meaning replace the teeth if they need to be replaced with your own tooth if it's been avulsed, or if it's been fractured or cracked open, protect it for the next 24 hours with a splint. Or if there's an abscess, we can either drain it, treat it with antibiotics, those sorts of things. So yes, we'll deal with the emergencies relating to the mouth, but dentists will also deal with the emergencies relating to the mouth. Have you ever had a dental emergency and had to go to the hospital? Let me know in the comments. What happens when someone arrives to the ER that needs to go to a mental hospital? Do they still have those? So yes, it's appropriate for individuals to come to the emergency department first. But if it's straightforward, a psychiatric care issue with a known history of psychiatric diagnosis, then it might be a little bit more prudent or easier to get that individual to the psychiatric facility because, the emergency department is a stressful situation, stressful environment, and could actually make matters worse for that individual. How do I handle those feelings of could I have done more or could I have done things differently to keep the person alive? I'm super sensitive, so a profession like this where death can sometimes be inevitable, I think would eventually be too much for me to handle. For me, I can only answer this on a personal level. I'm going to get the study done. I'm going to do what's appropriate for the patient. Now, are there situations where you did everything, literally everything on the sun, and still a bad outcome happens? Yes. And you might, feel like you're beating yourself up. If you get into that situation, there are team members that are helpful to go over scenarios with you. I typically try not to bring the cases home with me mentally, and so that's why I have a good home network, friends, my wife, family, and doing activities outside of the hospital that make me happy and thrive and make me continue to love life and not think about the negative things that do happen. Well, these are really great questions and I appreciate them. Keep them coming. And if you guys like these type of ER questions, let me know that in the comments and send me questions in the comment as well. And if you enjoyed this, definitely check out this playlist right here, Binge Watch Everything. And make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.